Welcome to the AETCM, the Emergency Medicine channel. Shall I? Today we'll be presenting a case of 22-year-old male who presented with alleged history of snake bite to the ER.
Okay.
On 10-second assessment, patient was conscious oriented, airway patent, there was no secretion, gurgling, stridor. Breathing, patient was maintaining a saturation of 97% at room air entry bilaterally equal with a respiratory rate of 14 per minute and single breath counts was 30 per minute. 30. On circulation, patient had a BP.
What is this single breath count? Where all it is useful in emergency room?
Snake bite.
And what is this single breath count?
To know whether there is a progressive respiratory.
How do you do this?
We ask the patient to take normal 3 breaths and then ask the patient to count from 1 and in a single breath.
Okay, then?
After every 20 minutes we can
after some time again
reassess the patient.
So normally which all conditions you get a reduction in single breath count?
In snake bite it can be the in GBS.
Okay. So 3 important
myasthenia.
3 important conditions. One is snake bite, second one is GBS, third one is myasthenia. Okay. Other respiratory conditions we don't do this. This is mainly to know neurological type of paralysis, especially which part of respiratory system is paralyzed here? Diaphragm. Okay.
On circulation, patient was maintaining a BP of 126/88 with a pulse rate of 90 per minute. 2 large IV cannulas were inserted at this time. Disability, patient had a GCS of 15 out of 15 and pupils were equal.
What are the types of bites? You deal with lot of bites in emergency. What are the types of bites? You get problem in the pulse.
Scorpion bite.
Scorpion. That is the most important. Scorpion bite can have some problem in the pulse. What are the problems you can come across in scorpion bite?
Patient can have a
Patient can have tachycardia. Then that is not the only problem. That can occur in any frightening condition, like you get any bite, you get frightening, and tachycardia is common. What is the peculiar nature of scorpion sting? Tachycardia is the answer given by an MBBS student. You are a PG. Your answer should be more sophisticated. It's an autonomic dysfunction. What do you mean by autonomic dysfunction in pulse examination? That is a problem can occur like myasthenia gravis. You can get GB syndrome. You can get this scorpion stings. You can get. What is the peculiar nature of that type of pulse? They can have tachycardia, they can have bradycardia. Tachybrady syndromes. The tachybrady syndromes are different issue. The tachybrady type of combination. Sometimes you can have tachycardia, sometimes you can have bradycardia. Sometimes you can have a high BP, sometimes you can have low BP. ECG can have ST elevation, ST depression, TIVO inversion. So many problems can happen if you have an autonomic dysfunction, especially conditions like scorpion sting, myasthenia gravis and GBS. Okay, all these have similar type of feature. Trauma to cervical spine. Okay, not cervical spine, thoracic spine. Okay.
On disability, GCS 15 out of 15. Pupils were equal and reactive. Exposure, temperature was 98.6 Fahrenheit.
Okay. Is there any problem can happen in GCS in snake bite? At any point of time, can you get GCS?
Yes, the patient can have muscular problems.
That will reduce GCS. Normally in snake bites it will not affect the GCS, but neurological bites you can have ptosis, ophthalmoplegia, all these things that can mimic some reduction in the GCS. Some patients may not respond to your commands. Normally they will not have loss of consciousness till the late phase of like they can have respiratory paralysis, then coma can happen. Otherwise normally GCS is not reduced in snake bite.
Adjoint to the primary survey, initially a VBG was done which showed no acid-base deficit. The creatine RFT values were normal. Secondary survey.
Which all bites you can have altered creatine, urea, muscle enzyme elevation?
Pit.
Any viper bite? Any one more bite? Sea snake, that is very important. Sea snake bite and viper bites, you can have elevated urea, creatinine, muscle enzymes can be altered. Okay.
Secondary survey, 22-year-old male with no known comorbidities presented to ER with alleged history of snake bite while walking in the road. There was a water collection and patient accidentally walked through it, suddenly noticed snake over the left foot.
Okay.
On local examination, there was a fang mark on the lateral malleolus of left foot.
Okay.
No history of diplopia, ptosis.
When you are dealing with the snake bite, what is the importance of fang mark? Is it really important, not important? Not important. Suppose you get a snake bite case, he is having ptosis, but you are not able to find out fang marks. What will you suspect? Crate bite. Okay, suppose you see a fang mark, not able to see any clinical finding. What is the diagnosis? It's a dry bite. What do you mean by dry bite?
Without any mark and venom.
Venom is not injected, but the patient has bitten by the poisonous snake. Okay, it indicates a poisonous snake bite, but it may not the venom has not been injected. Okay, during any phase of snake bite, patient can have sudden death. Suppose you see a patient who had snake bite 10 minutes back. Here, the patient was brought to ER after death. 10 minutes, can the patient die? No? You tell me, what is the situation, what is that problem happening in that patient? So what are the conditions in snake bite patient can have sudden death? Either patient is frightened and he is developed vasovagal syncope or acute myocardial infarction. That is the commonest problem. Tachycardia in a patient pre-existing heart disease. Because of frightening, he can develop any acute MI and he can develop. Another important problem is venom might have injected directly to the vein. That is the most important problem of snake bite. Normally you get a bite, mostly it is on the muscle, it takes some time to get absorbed, go to vein, reaches heart. But if the fangs are directly to a vein, then it will inject the venom to the vein and it can reach the heart very fast. That can sometimes produce severe effects, especially in viper bite. Okay.
No history of diplopia, ptosis, weakness or trismus. No history of any local swelling or edema.
Trismus is a feature of snake bite? Huh? Trismus is, what is trismus?
Jaw.
Jaw?
Locking.
Is it seen in snake bite? It's a feature of tetanus. Late phase of the snake bite you can get, but early phase trismus is not a feature of snake bite. Whatever you told, ophthalmoplegia, diplopia, all these things are feature. Okay.
No history of any local swelling or edema. No history of
actually what is happening in neurotoxic bite, what is happening to the eyes?
There will be initially diplopia, then patient can have a ptosis, then patient can go for the external ophthalmoplegia.
Diplopia is due to external ophthalmoplegia. Okay. Ptosis will be the earliest sign of any poisonous snake bite. Okay. Any neurological poisonous snake bite.
Patient has no history of any inguinal lymphadenopathy. Other systems exam.
Is that lymphadenopathy painful or painless in snake bite?
Painful.
Painful. Okay.
Other systems were within normal limit.
Okay.
Then we started for single breath count monitoring.
Okay.
Then INR was monitored every 6 hourly.
Okay.
INR of the patient was 0.90.
Okay.
And PT was 12.9.
Okay.
Then platelet count was checked. It was normal.
Okay.
RFT values were normal. ECG was taken. ECG was with normal sinus rhythm. Patient was given a dose of TT 0.5 ml IM, and then patient was observed for 24 hours. There were no signs of envenomation. Then patient got discharged with antibiotics to prevent the local site
infection. Here you have encountered a patient with dry bite. Okay. So what are the indications for ASV in a patient with snake bite? That is very important.
Patient,
Even after seeing the fang marks, we have not treated the patient with anti-snake venom. Okay.
patient having any local site.
So local reactions are very important because the snake is injecting protein to the body. So second thing is,
If patient have any systemic features like
other one is lymphadenopathy. You already told lymphadenopathy is a very classical finding of this hematological bites like viper bite. Okay, we look for the lymphadenopathy. Then abdominal pain. Okay, next thing is abdominal. Very commonly you see abdominal pain. Then
neurological symptoms.
neurological findings. Okay, what neurological findings you looked here?
We look
Ptosis
for
and
ptosis, diplopia,
diplopia and single breath count. Single breath count. Okay. Then hematological problems. What all things you looked
There
here?
can be bleeding from the local site, subconjunctival hemorrhage,
Okay.
epistasis can be there,
Okay.
hematuria can be there.
Okay, nothing was there, and you did some lab investigation. What are the lab in?
Initially, till the PTINR comes, we have looked for the whole blood CT,
Whole blood
clotting time.
Okay.
Then after that, we look for serially, we look for the PT and INR.
What is the difference between whole blood clotting time and PTINR?
Here what we do in whole blood CT is we take a clean glass tube and then we take the blood and then keep it for 20 minutes, seeing for the clotting time.
Okay.
So they
So
can
20 minutes you keep. Suppose it is clotted. What is your inference?
there can be some coagulation.
Clotted.
And clotted means no
No,
coagulopathy,
okay. If it is not clotted,
abnormal.
okay. So after 20 minutes, what you do?
We repeat the
Repeat the sample and keep it again. Why we are doing PTINR then?
PTINR for CT to see an abnormality, there should be at least 40% of coagulopathy.
Okay.
But in PTINR it is more sensitive.
Okay. Even 10% itself, PTINR can be elevated. What is the danger level of PTINR? When will you see that this is abnormal?
More than 1.5.
1.5. More than 1.5 is a panic level for treating the patient who is not having any existing liver disease. Okay. How frequently you have to do the test?
Every 6th hour.
Why every 6th hourly? So all things are important. Every 6th hour it takes to regenerate the coagulation factors. So even when you are treating the patient, every 6th hourly you have to check the PTINR and document that this patient is improving or deteriorating. Okay. So now how to manage this is a poisonous snake bite, but poison has not ended. That's why we call it as dry bite. How do you manage a case of poisonous snake bite? Who come to emergency room, you have done all this investigation. You have two types of snake bites. One is neurological, other one is non-neurological. Neurologicals are mainly cobra, king cobra and crate. How do you manage all these things?
If the symptoms are there, then we start on a polyvalent ASV.
Okay.
Usually we
Do
give
we have any monovalent ASV? It is not available. In our country, it is not available. We have polyvalent ASV for how many snakes?
4 types of
For big snakes. Okay. So what are the big fours?
cobra, Indian cobra, crate, common crate, Russell's viper, and saw-scaled viper.
Okay. Does it cover king cobra and Amnos pit viper?
No.
Normally it may not cover, but some cross reaction can be there. Some coverage will be there. Okay. Scientifically, if you are telling it may not possible, we are taking from this big force. Okay. Now how do you manage with ASV? You are seeing a patient who is having some neurological finding or your PTINR is elevated. How do you start ASV?
Usually we start with 10 vials of ASV. One vial contains 10 ml. So it comes as freeze dried. So we dilute in 10 ml NS and then we give as 1 ml, 2 ml per minute.
Okay. Should we give test dose?
No.
If we give test dose, what will happen?
There can be some irritation to the skin, so there is no
Normally it does not require test dose. Even if you give test dose, it may not show any reaction. But if you start ASV and patient develops a reaction to that, what are the common types of reactions you can observe in patients who is having anti-snake venom induced reactions?
And a patient can go for anaphylaxis.
It is a rare situation. What are the common situations?
Patient can have itching and
Itching is the most common finding. Many patients will complain about itching, but you have to see the BP. Some patients develop hypotension also. In that case, you have to stop it. If it's simple itching, you can just give some chlorpheniramine malate, or if there is hypotension also, you can give adrenaline like what you give this one. But temporarily, you have to stop the infusion. The patient develops hypotension, we have to stop the infusion, give some adrenaline like you treat anaphylaxis, then Avil can be given, that is chlorpheniramine. But we have to restart the medication. We have no other option. Okay, we have to restart the medication. Okay, so 10 vials initially you give. Suppose the patient does not improve.
Then we again repeat after it will be over within 1 hour. Then we'll again go for another 10 vials.
Okay. Then if the patient does not show improvement.
Maximum up to 30 vials.
So maximum up to 30 vials are enough. More than that will not work. Okay. So that is not required. So we should not give more than 30-35 vials. That may be the maximum. So some hospitals start only 5 vials initially. Some hospitals start 10 vials. It all depends on the experience of the clinician. So you can start 10 vials or 15 vials depending on whatever you want to start. You have to decide the doses. Suppose you are seeing a heavy snake bite, bleeding tendency is there. You have seen the snake, it's viper, large viper. Then you may have to give 30 vials as first dose itself. It can take 3 hours and you can finish it off. Is there any difference between small snake and large snake? No. Yes or no? No, it is not there. So there is no difference in the venom of small or large snake. Even small snake venoms are more dangerous than large one. Okay, then is there any difference between child and adult patient? That is also no. Okay, there is no difference between the victim or the snake. Okay, size of the snake or size of the victim is immaterial. Okay, you are only treating the clinical profile in that patient. Okay, then if the patient develops neurological toxicity, how do you manage?
Neurology, initially atropine can be given. Then after that we give a dose of neostigmine.
Okay, why atropine is given?
To prevent the bradycardia.
Okay. Neostigmine normally produces bradycardia. To prevent that, you pre-atropinize. Some doctors keep atropine ready and give neostigmine. If the patient develops this one, you give atropine. Where else you use this in clinical practice? Myasthenia gravis. Myasthenic crisis also you do same thing. You can see many neurologists, they give neostigmine. They don't give atropine. They keep the atropine ready. And if the patient develops bradycardia, they give the atropine. But in snake bite, normally we give atropine before neostigmine, then give neostigmine. Okay. If a patient is allergic to your ASV, you are not able to give ASV at all. It's a cobra bite. What else you can do? What else you can do? You have a patient who is having cobra bite. You know that it is cobra bite. Patient is having breathing difficulty. You have started your ASV, that has produced reaction. You are not able to give it at all. What do? You have to give it and also give atropine. You are not able to give. Immediately patient develops severe anaphylaxis, shock. You are not able to restart. That situation can happen. What else you can do? Suppose you cannot give, what you do? You have to give. You wish to give ASV, but unfortunately we are not able to give. In cobra bite, there is an advantage. You put the patient on ventilator. You give your neostigmine or whatever it is. Patient will improve with that. Only with that your mechanical ventilation and neostigmine and atropine, patient can improve. Whereas other conditions like you have a viper bite, patient will not improve only with your other supportive therapy. Patient may deteriorate. Okay, that is a problem. Suppose the patient develops bleeding tendency, PT-INR is elevated. What you do?
We can go for a fresh frozen plasma.
You should not tell like that. Don't jump to conclusion. You have
fluids, crystalloids can.
You have a patient with PT-INR is elevated in viper bite. What else you see? You have to do 2 more investigations. Then it is correct. What you have to?
Fibrinogen levels.
That you have to do. You have to, if PT-INR is elevated, you have to ask for an APTT. Then you have to see the fibrinogen levels. The treatment is entirely different. That's why. The only PT-INR is elevated, what you told is correct. You give FFP, that is more than enough. Suppose fibrinogen is reduced, then what is your diagnosis? Patient has gone to DIC. There, your FFP alone is not the treatment of choice. You have to add cryoprecipitate. That you have to keep in mind. Any patient who is having elevation in PT-INR, especially conditions like snake bite or sepsis, you have to add two more investigation. One is APTT, other one is fibrinogen. APTT is also reduced. Both the pathways, your intrinsic pathway and extrinsic pathway, are affected. Then the final common pathway is the fibrinogen production. That is also affected. If that is affected, you cannot treat only with your FFP. You have to give cryoprecipitate also. Okay, so that also has to be given. Okay, now you talked about TT. Is it a must to give TT?
Yes.
All bites you have to give TT. You talked about antibiotic. Is it a must?
Yes.
It is not a must. Okay, that you should remember. Snake bite does not require antibiotic at all. Okay, if the patient develops an infection, inflammation, that is secondary infection. Some bites like that may contain anaerobic organism. If the patient develops severe local swelling and infection, then you will have to give an antibiotic. What antibiotic you prefer? So here you have started antibiotic. I am not telling it is wrong. Okay, but without any evidence of infection, we have started. We can tell that we assume some infection and we have started. Okay, what antibiotic you prefer?
With coverage of any ropes.
What is antibiotic?
Doxycycline, ampicillin.
Doxycycline. Okay, so simple penicillin, doxycycline, amoxicillin, anything is okay. So here doxycycline is enough. Snake bite as such does not require antibiotic. Secondary infection may require. Okay, if the patient is having viper bite, okay, what else you monitor in that patient? Viper bite. If you see viper bite, you'll understand the problem. What is the most important complication in viper bite locally?
There will be edema, blebs can come.
Then?
Lymph nodes will.
It is not an issue, no, lymph nodes will subside.
There can be.
Hematology? Hematoma, and what is the problem? What is the problem?
Compartment syndrome can.
Compartment syndrome is very important. Acutely, patient can develop compartment syndrome. After few days, severe ulceration can develop. Okay, blebs, ulceration can develop. But acutely, patient can develop compartment syndrome. How do you diagnose compartment syndrome? How do you diagnose? Clinically, how do you diagnose? Pulse, book says pulse, but that is not the actual thing. The pain, the severe pain which is not correlating with the finding, clinical finding. Pain symptoms are more than expected pain symptom. If you are seeing in any patient who is saying swelling in the lower limb, that is same in trauma, snake bite. Anywhere it is like that. If there is a swelling and the pain is excruciating pain, then you have to suspect a compartment syndrome. Handheld Dopplers are here in emergency room. We can use that. Sometimes you may not feel the pulse because it is already edematous. Okay. How do you manage compartment syndrome? Fasciotomy has to be done immediately. Can you measure the compartment pressure?
Yes.
It can be measured. There are some devices for that. We can also develop with our BP apparatus, but that all things are not possible in a busy emergency room. So it is better to do the fasciotomy or what is that called as escharotomy. That can be done if you are suspecting like compartment syndrome. Okay, ulcers. Long term, what are the problems can happen in ulcers? It can develop, patient can develop non-healing ulcers. Okay, if a snake bite patient, like especially viper bite patient, suddenly develops hypotension, what are the possibilities? After immediately after bite, what is the possibility? After 2 days, what is the possibility? What are the possibilities to have a hypotensive shock in a patient who is having snake bite?
Hypovolemia.
Immediately you get a bite and the patient is having hypotension. What is your diagnosis? Immediately after 2 minutes of snake bite. It is vasovagal shock. Okay, heavy pain or because of the fear, you can have vasovagal shock. After some time?
Hemorrhagic shock.
After some time means after starting your ASV. Hemorrhagic shock means the blood will go like that. You think that blood will... It is not a trauma, no? After starting ASV, because of ASV reaction can occur. Second day of snake bite, if the patient develops acute hypotensive shock, what is the most important diagnosis? How do you manage it? Hemorrhage only, but where is hemorrhage? What you told is correct. It is hemorrhagic shock. But where is hemorrhage? Abdomen. Adrenal hemorrhage. Adrenal hemorrhage. Adrenal hemorrhage can occur in many conditions. including snake bite. What is Waterhouse-Friderichsen syndrome? You may be knowing that. What is it? Huh? Which meningitis? Which meningitis? Meningococcal. There also adrenal hemorrhage occur. In viper bite also you can get adrenal hemorrhage. Okay. What chronic complication can occur in viper bite because of this type of hemorrhages? Pituitary
Insufficiency.
Pituitary insufficiency is very common in viper bite which is not treated properly because of pituitary hemorrhage. Okay, so hemorrhage can occur everywhere. It can occur in the eyes, it can occur in the pituitary gland, it can occur in the adrenal gland. Depending on the area, you can get problem. We had a snake bite, viper bite case. He had pituitary hemorrhage and he developed hypopituitarism. He was a matured adult, so he had only one problem, that was male hormone deficiency, testosterone deficiency. Okay, he used to come and take testosterone every month here. Okay, so that also we need to follow up these patients sometimes. Viper bite, hum nose pit viper. What is the difference between normal viper and hum nose pit viper? Both are vipers. Clinically, what is the difference? Will your ASV work there?
No.
Normally, it may not have good effect in hum nose pit viper. What is the classical difference between normal viper bite and hum nose pit viper? They have more profound renal failure and the response is very delayed. These patients may require many months of dialysis. Comparing to normal your other type of vipers, these patients may require many months of dialysis to recover. Okay, so that is a problem in hum nose pit viper because we are not able to treat the patient with ASV. What is this ASV doing in our body? What is the action of ASV? What is this ASV? Anti-snake venom contains what? Immunoglobulins against? Venom is a protein. So this your ASV contains immunoglobulins against this venom. This is a performed immune mediated structure. So if you inject, what will happen? It will go and neutralize the venom. Okay, suppose you have a snake bite. Okay, today you have a snake bite. By tomorrow you have developed renal failure, whatever failure, your creatinine is elevated, your liver is damaged. So after that, can we give ASV?
Yes.
You can still give. Ongoing progression in the disease, you can still give. But what happens is, once the venom is attached to an organ, target organ, you cannot neutralize it. It has already produced the damage. So there it may not be ineffective, but ongoing progression in the disease, we have to always try for ASV. Some conditions you can give up to 2 weeks of ASV, but theoretically it is not correct. First day itself you have to give. Whatever antivenom you want to give, first day itself you have to give. Some doctors you can see one vial TAD maybe like for 5 days they might write. That is not correct. Suppose you decide to give 5 vials or 10 vials or 15 vials, that has to be given as a single dose. That is the best dose. Okay, no need to wait for second day or third day. Okay, but still if the patient is deteriorating, you can give second day also. Okay, anything else you want to tell? You want to add anything? No. Okay, thank you.